On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Garner Newton, Dr. Jeff Angobaldo, Dr. Michael Musacchio, Dr. Daryl Stewart. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center is one of the top medical centers in all of the Dallas-Fort Worth area.
Exactly right, Candace. Also, some of the best doctors in the entire Dallas-Fort Worth area operate right here out of beautiful Forest Park Medical Center, like our first doctor, Dr. Garner Newton.
I was experiencing pain in the right shoulder up into my neck. I'd seen Dr. Newton before for some hip issues and thought he was the man to see. Dr. Newton took several x-rays, subsequently an MRI, and announced that I had a torn rotator cuff.
The most common way to tear a rotator cuff is really as we age, because of the blood supply and part of the rotator cuff is not very good, then it tends to tear.
I was concerned about my athletic endeavors with golf and swimming and the activities that I like to take part in. It caused me not to sleep very well or be comfortable in any one position for a period of time.
It's a very common complaint of a rotator cuff tear is basically having pain at night that tends to wake them up or they can't sleep on that side. The first thing you do is get a good physical exam. It's very important to get a good physical exam and history to see how they may have injured it, because you want to pick out if they injured it in a specific trauma or a lifting type episode, because it matters a lot on what you decide to do as an orthopedic surgeon.
Dr. Newton suggested that surgery was in fact the solution, that it would not heal itself and the pain would not subside. The discomfort would not subside. It was a very easy election.
The rotator cuff surgery is something that can be done either arthroscopically or through a mini open type procedure. The way I decide to do it has a lot to do with the type of tear, how big the tear is, and the patient. If we decide to do it through the scope, the incisions are obviously much smaller, but that would require, in my opinion, a smaller type tear that wouldn't require multiple anchors, multiple sutures like in a large to massive tear.
Dr. Newton made it very clear that with each patient and each surgery it could be slightly different. He was very optimistic that it was a routine procedure and that I would be pleased with the outcome, which I was. It's been 8 months. I feel fairly unlimited at this moment in time. I feel that I'm on my way to being 100%.
Well, we are from Bolivia. I came 2.5 years ago. My father and my mother, they started to seeing something strange with my baby girl.
I think the very first time that I noticed, and I was the one that really noticed that there may be an issue, was when I first held her in Bolivia. She was just a few weeks old. I just noted that she didn't appear to be responding to noise and sounds around.
I was thinking that she was okay, that nothing was wrong. Maybe she's distracting, I don't know. When they told us that she wasn't listening, it was hard because I want she can listen to me or she can listen herself. So sometimes it's frustrating that you talk to the baby or you want to teach her something and you can because she cannot listen.
Well, we first contacted Dr. Peters in Dallas Ear Institute, Then we knew that he was the president of the foundation, of Dallas Hearing Foundation. And we talked to him, and they started looking for a device for Mia. And I'm glad that they found the right one. And hopefully, and with God help, that's gonna work good. It's gonna work good.
Med-El, along with the Dallas Hearing Foundation, we share a commitment to the hearing loss community. And when the Dallas Hearing Foundation approached Med-El, we thought this was an ideal situation to kind of help out a family. And so we put them into our grant process. And as the patient goes through the grant process, Mia and her family were approved.
Mia was born with profound hearing loss, and that means that hearing aids were not able to give her enough hearing. So the only way she would gain adequate hearing in order to develop speech and language, oral language, would be to have a cochlear implant. So today we placed a surgical implant that is meant to stimulate the hearing nerves that are there but just not working, and it will stimulate those nerves and produce for her a sense of hearing. We test the implant and determine during surgery that she is responding to the implant. We actually do not turn it on for 3 weeks. We want to let her incision heal. So we won't turn it on for 3 weeks. So she's just going to have, like any typical ear surgery, have some recovery time and some discomfort. But 3 weeks from now is when we'll bring them back to our office and actually activate the implant.
Wow, for her it's going to be a big difference. From not hearing to hearing is a big change. She was living happy without hearing, and now hearing she's going to be happier. That's why we're here. That's why we're in America, in Dallas, in this big hospital, good hospital, and with the best devices that she can get.
Thank you, Dallas Hearing Center. Thank you, Forest Park Medical Center. Thank you, Dr. Peters. Thank you, Linda, Debbie, all of them.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients. And working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just so much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and he'd say, Daddy's sick, and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts.
I am the Director of Critical Care, so I have a couple of different departments that handle all of our really critically ill patients here at the hospital. And when I came to Forest Park, we were just starting, it was brand new, and so I got to get in on the ground level. I got to participate in developing our new policies, our processes, and it was really rewarding. To be a nurse at Forest Park, I look for 3 things. I look for someone with excellent nursing skills, someone with excellent customer service skills, and someone with a great personality. Because we are a small hospital, I have small departments, and it's really important for a new employee to fit into our family. As a Director of Critical Care, I think honestly the physicians don't want to have to use my departments. However, I think they find it a comfort that if they should need the emergency room or if they should need the intensive care unit, we're here, we're ready to take care of their patients, and we can take care of their patients just as well as anywhere else in the Metroplex can. When I first came to Forest Park, I was not familiar with bariatric procedures at all, and so I found it very interesting and very rewarding to learn new things. I think that unless you've worked at a hospital like Forest Park, you're gonna find that there's a lot to learn, a lot to do, and a lot of rewarding experiences to be had here.
All of the physicians that operate right here at Forest Park Medical Center are dedicated to changing people's lives. Like our next doctor, it's Dr. Jeff Angobaldo.
For the last 25 years, I have taken care of everybody but myself, and I have 3 children, had them very young, and I haven't really had an opportunity to take care of myself. So it came time for me to renew my lease on my vehicle, and I made a decision to get a luxury body versus a luxury vehicle.
My makeover is a term that we use to describe a combination of abdominal surgery, breast surgery, and liposuction. Breast surgery entails breast augmentation, breast lifts, or breast implants with a lift. Abdominal surgery includes most commonly an abdominoplasty or a tummy tuck and liposuction.
I wanted implants, and I also wanted my stomach fixed from surgeries, from having children. Seems like no matter how much weight I lost or gained, I just couldn't get my stomach the way I wanted.
She's very active now in running and in exercise and going to the gym, and she just couldn't firm up her lower abdominal area and her breast tissue. So no matter what she did, it wasn't going to be corrected with exercise and dieting. The plan that we chose for her, which included abdominoplasty and breast lift surgery with implants, was a plan that was tailored for her to help her with the issues she's had with her breasts and her abdomen.
After my procedures, I was actually able to go home. I didn't even stay a full day. Even having all 4 procedures done at the same time, I was able to go home like 12 hours after.
It's about a 2-week recovery of no activities. All they're doing is just walking around the house, and they're bent over. They need to be bent over to decrease the tension on their closure. After 2 weeks, they increase their activity level to mild activities. After 4 weeks, it's moderate, and after 6 weeks, they can fully engage in whatever activities they were doing prior to surgery.
I'm very pleased with the outcome, and I'm very comfortable. I was looking for something a little more natural, not so it looked like I was having procedures done, and he did exactly what I asked.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to beststocksnetwork.com.
As always, for more information on any of the doctors you've seen on today's show, just visit our website, beststocksnetwork.com, and be sure to click on that Forest Park Medical Center tab.
Now to another outstanding doctor who operates right here out of Forest Park Medical Center. It is Dr. Michael Musacchio.
Before I came to see Dr. Musacchio, I was having a lot of pain in my right leg, to the point that I couldn't sometimes move, bend, or even walk.
Judy came to see me with a long history of a low back and a leg pain, and it was getting worse and creating more and more discomfort for her. The pain would start in her back and go all the way down her leg. She did come after having seen chiropractors and failing to improve with that and trying other methods of treatment outside of surgery.
It affected just my everyday life. I could not sleep, I'd wake up in pain, so I knew I had to do something.
What we found was that Judy had not only an instability in her spine, and she also developed a degenerative cyst. These degenerative cysts can act much like a herniated disc, and that they can pinch the nerve. And in pinching the nerve, it causes a significant amount of pain and discomfort to go down through the back and the leg.
He just really did make me feel comfortable, made me feel relaxed. I knew that I was going to do the right thing by doing the surgery.
The purpose of the surgery was to not only decompress the nerve by removing the cyst, but also to stabilize the spine so that the cyst didn't recur, and to help alleviate her back and her leg pain. We did use a minimally invasive approach with Judy, and that involved doing a fusion and placing bone grafting and screws in the spine, but doing it in such a way that with a computer-guided system that creates somewhat of an intraoperative three-dimensional image of the spine that allows us to use a percutaneous approach, which is to say minimal muscle disruption, and really help the computer navigate the screws into the spine with very small incisions and very little disruption to the normal tissue.
The way I feel now compared to how I was feeling before is like night and day. Before, I was just in constant pain. Now, which I can move, I can bend, I don't run, but I could. Exercise, it's just totally different. It's totally different. There's absolutely, and when I say this, I mean absolutely no pain at all. I'm glad that I saw Dr. Musacchio.
Diane has a question for Dr. Dan Aldridge. How do I know I have broken a bone?
A lot of people grow up being told by their mothers or other family members, whoever plays the doctor in the family, that, well, if you can move it, it's not broken. I know I was told that when I was a kid. That's definitely not true. Even if something's really badly broken, you can still move it. The signs of a fracture are pretty consistent, though. It's going to be pain that does not resolve but gets worse over the first 2 or 3 days, and the same thing with the swelling. A simple injury will often feel better the first or second day. For the fracture, it does not. It tends to feel worse, especially for the first several days. More painful, more swollen, very difficult to to move. Some movement can be done, but it's definitely not your normal movement. Those are signs. Bruising, if there is any discoloration that occurs quickly, bluish, greenish, that's a sign you've got a fracture. Significant swelling that doesn't go away after the first day or two. Those are all signs that you might have a fracture. And difficulty with weight bearing, if you can't put weight on it after a couple days. Those are all signs that you probably need to get an x-ray.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination or IUI. That's where we'll take the partner sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in the lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis, for these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
Don't forget, for more information on any of the outstanding doctors that operate right here out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on the Forest Park Medical Center tab. Right now, time to head to our next doctor who operates right here out of Forest Park Medical Center. It's Dr. Daryl Stewart.
I had a lap band performed by another physician, and then in 2010, Dr. Stewart did a revision to the duodenal switch because I was having so many complications from the lap band, specifically with my esophagus. I was having trouble keeping down liquids, and just eating was a problem for me. So it was really taking its toll physiologically.
Revisional bariatric surgery, what is it? It actually is somewhat of a vague term. It could mean anything from trying to fix a problem. You know, someone has a surgery and they have a problem with it, they need a little help to get, to get over that, whatever a side effect or complication or just symptom, is. But it could also mean that the patient is unhappy with the results.
I did significant research and found Dr. Stewart online, and I liked the fact that he offered several different weight loss surgeries, which was key for me to have a choice as a patient. I used his website to research the specific surgeries, and I felt like duodenal switch was the right surgery for me. It offered a chance for me to maintain a normal weight and also lessen the chance of regain later on down the road.
When we have patients that come to see us who've had another procedure and they just haven't had good results, or maybe they had good results initially and then they've regained their weight. Our approach is going to be not to blame the patient, but to look at did the patient have the right procedure to begin with. I'm more going to counsel them about, well, maybe we need to take a different approach, and maybe that approach needs to be tailored after your particular, situation.
Dr. Stewart as a person is just wonderful. He's very precise, and you can tell he's a very skilled surgeon. He explains things in detail. He makes it to where you're ready to take that next step. And his whole entire office staff walks you through the process step by step, so you don't feel afraid. You feel like you can confidently go forward.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. Did you know that Forest Park Medical Center is equipped with a high-tech tube system that sends stat lab work from any location in the hospital to the lab? This enables the lab to test samples quickly for better patient care.
Mark Vaggi is a 52-year-old gentleman with severe arthritis of both of his hips. We usually don't see arthritis in such young patients like Mark, so he brought a special, unique case to our attention.
The process started about 4 years ago, and it was just a slow deterioration over those 4 years. The simple things started becoming very difficult for me, so I knew it was time that I do something. I'm still young, I still trying to stay active, and I knew that this was something I really needed to do.
Mark is still working. His job is very important to him, and getting him back to his job as quickly as possible was a very important concern of his. So by performing bilateral hip replacement, both hip replacements at the same time, we were able to get him back to work much quicker than if we did one hip followed by the other. Mark had the anterior approach to total hip replacement. This is a special procedure in which we go between the muscles units instead of cutting muscle. Because we don't cut any muscle when we perform this procedure, the rehabilitation is much, much quicker.
At 1 month after total bilateral hip replacement surgery, my mobility and my overall condition is probably, I would say, 10% better than it was prior to my surgery.
Mark is back to work. He's walking independently without a walker or cane. If you didn't know Mark had both hips replaced simultaneously, it's very hard to tell because he doesn't even have a significant limp.
Not only am I happy about the decision that I made to get my hips replaced, I am excited about the prospects of actually being able to have a more active summer. I'm looking forward to this summer for the first time in a couple of years. I'm looking forward to getting back to doing a lot of the things that I really enjoy, and I'm confident that in the next couple of months I'm going to be right where I want to be.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center is one of the top medical centers in all of the Dallas-Fort Worth area.
And for more information on any of the outstanding doctors who operate right here out of Forest Park Medical Center or anything about Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
Absolutely, and if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.